So, in the week since learning of this opportunity to share stories on community and public health, I discussed with a few close friends how I might try to attempt to do justice to these themes. Themes that are so much about, they drive so much of how I experience the world. And one such friend that I was talking to was gently reminding me how I had already said most of it to her in our conversations. So, this is an attempt to share the essence of those exchanges. The scope of public health can make it seem as though individuals have very little effect. And then a moment will remind me what underpins all of it are the individuals themselves, their stories, everything that led to whatever moment we're in or decision we're trying to make. Holding space for genuine connection between those of us who are working in these spaces and those we serve is essential because outside of these roles, we are all members of a shared idea of community. Through these moments of human connection, people become three dimensional. Every time we remember and feel this truth, we push back against these false dichotomies of you versus me, us versus them. So, the insights that I have rarely come in a grand way. They usually present more as blips across time and place. A conversation in New York will connect to a moment in Michigan, and experiences in India will have a through line back to another in New York. So, here are a few such moments. One day, while volunteering at a food bank in New York City this past summer, I found myself alongside an individual who was so put together. This person was an artist by vocation, and she was imbued with confidence and humor. Over the hours of shared work and conversation, she revealed more moments or more aspects of herself to me. She talked about her grief over losing a parent when she was young, her struggles with self-image and eating disorders, and how generational cycles shaped her and her family, and how they were entangled with larger societal messages about how one's worth is evaluated. Beneath style and security was another human being looking for peace while navigating pain and hope. A few years ago, as part of a team at a no cost community health clinic in rural Michigan, I was witness week after week to the various needs and truths of those utilizing the clinic services. Many patients worked full time, but could still not consistently afford the cost of medications for some of their chronic conditions like diabetes. I remember chatting with another established patient over the months at the clinic, and he never complained when there was a long wait, and there was almost always a long wait. And he would stay after his appointment to continue conversing with office staff. And eventually, what I learned was that these moments were one of his main sources of social interaction. Another moment was shadowing a bilingual provider at the clinic and seeing how her ability to communicate fluently and in a way that developed rapport and trust, how that helped reveal additional and relevant layers to a patient's complex health history, and ultimately that refined their care plan. And last year, when I visited relatives in India after many years away, I was reminded again of the universality of humans' desire for self determination, belonging, safety, and understanding. Sometimes it took different forms within tradition, religion, or social systems, but the essence was the same. Soon after returning to New York from India, I was part of the care team for an adolescent patient who was hospitalized for complications related to anorexia. Through many 12-hour shifts together, I came to appreciate her pride in her family's traditions, her pride in her family's spirituality, as well as her desire to honor that and not be subsumed by it. When her parents came to visit, I witnessed her joy at seeing them, as well as her pain for how their love and despair often echoed the very messages she identified as part of the cycles she was trying to break. Often, connection seems like a luxury our healthcare system can't afford. On the surface, it appears like it won't fit with healthcare metrics related to efficiency. But again and again, as a nurse, as a volunteer, and as a member of the shared community, I've come to see that while science and knowledge give us tools, astounding tools. It's our interconnectedness with other beings that gives us purpose. One form of that is in the stories we tell and the space we hold for one another. When we lose sight of this, every protocol, every policy, every system we design, they are similarly limited, as they miss core aspects of what it means to not only exist, but have a chance to thrive. Thank you.